Welcome to the CAN TV Live. At this time, you are going to be introduced to Tacts, the Association of Clinical Trial Services. I am your hostess with the mostest, your community epidemiologist, Sister Simpson. In today's episode, we are going to focus on a very specific crisis. I know there's a lot in the news, specifically about the tax reform, but we're going to still focus on our ideology, which is about the opiate epidemic. If you're listening to this particular forum today and you want to know more about the opiate epidemic and more specifically what you can do about it, you can always give us a call in. The call in live number at 312-735-1068 is right there at the bottom of the screen. Of course, I always have to start off in showing you who we are and what it is we do. This is Tacts, the Association of Clinical Trial Services, where we bring the science to the people. We promote diversity in clinical trials research. So that means we think that with these agencies, diversity should be a part of how we approach and come up with a cure for all the ailments we deal with. In that concept of diversity, we deal with what we call health equity. So as you can see in these two pictures, equity is different from equality. Equality gives us all the same box, irrespective of our size. But equity gives us the boxes we need, again, irrespective of our sizes. So we promote health equity. And understanding the concepts of health equity, we program ourselves to deal with different health ailments, or I would say health indices. One of those indices today is going to be around drug and substance abuse. We have our resident professional, he calls himself the People's Counselor, who's going to come up in a few minutes to give some more in-depth analysis about the opiate epidemic. What I thought would be important for us, though, is to really focus on how come we look at health equity. The reason being is because this approach, as you can see in this triangle here, health equity being in the middle, allows for the community, the policy makers, as well as our industry makers, the people that the universities have, to come together in a concept of health equity. I see that we have a caller. Welcome to the Tacts Call-In Live series. I'm Sister Ya. What can I do for you?
Hey, Sister Ya, how are you?
Hey.
It's good to see you again. I know you don't remember me, but I met you at the UIC hospital.
Yes, I do remember you, and you said you always watching and calling in. Hope all is well with your mom. And how are you doing this good evening?
I'm doing well. It's so good to see you. I was wondering about the health treatment, seeing if is there a cure to cure everything? I was hearing some rumors in the papers about there's something to cure cancer and all this stuff. It's going to be universal. You know what I'm saying?
Yes. Thank you, and I appreciate you calling in and always watching and being committed to the show. I appreciate that. Your questions around, are there cures? Are there cures for cancer, cures for different health ailment? And the answer to that question is, it depends. Cure comes in several different concepts. One concept is that if you have something, you completely eradicate it. That means take it all the way out the body as though you've not had it before, and then of course the body is allowed to heal from that. That is complete cure. But then they have other cures that we use the term, and it's treatment cures. Treatment cures means you take some kind of medication, and cancer you would say radiations or the therapies or the treatments. Any of those types of terminology means you use the treatment to get yourself cured. One that I can specifically speak on is there's a medication that is used for hepatitis C. And with hepatitis C, that is a virus that impacts the liver. And so some people who have contracted hepatitis C can take this treatment, if you will, of a specific treatment. I think it's 24 months to 24 weeks to possibly 9-week treatment. You take that treatment, and then the virus that is caused hepatitis C is no longer in your body. So that's called a treatment cure. So yes, caller, I really do wish we had more things that we can say that can cure people. But it seems like I got another caller tonight. Welcome to Tacts Call In Live with Sister Yao. How can I help you?
Hi, Sister Yao. I've got a question about these clinical trials.
Yes, sir.
Since I guess since you need diversity, how could I maybe find out more about those clinical trials when they're held in my area?
Excellent question. I appreciate that, caller. So the first thing you said, how do I find out more information about clinical trials that are being held in my area? I can give you a website. It is clinicaltrials.gov, G-O-V. The reason I'm giving you that website is that is a federal mandated website of clinical trials that are sponsored by the federal government, at least. It should be other ones such as university sponsored, or what we would call pharmaceutical sponsored, but the majority of the trials that the federal government has control over, they put it on clinicaltrials.gov. If you'd like, caller, you can leave your name and phone number or an email address, and I'd make sure that you get that. But in that website, if you will, it's www.clinicaltrials.gov. If you were to go there, in there it talks about various places in the United States of types of trials. So it's a little lengthy because, of course, it got to go by all states, right? And then once it goes by the states, it'll go by different types of trials, and it depends on what ailment or illness or particular health indices that they're looking to study. That's a very good question, and you are absolutely correct. Some people don't even know where to start. I say always start with clinicaltrials.gov. It's going to give you other resources to look up, and more specifically how to find this in your area. Here they're going to say Illinois because they go by state, but obviously you can look for things in the city of Chicago. The other thing that I can always tell you I'm going to tell you, you want some insider knowledge? You can always get in touch with the universities, such as, let's put one out there. Northwestern University has several different clinical research that they perform for different health indices. For example, the board that I sit on is for HIV. Northwestern has a board specifically for clinical trials research on HIV medications, and that particular board is actually local as well as national. They do trials that are here locally, and they conduct trials that are national. The reason I know that's because I sit on their board, their clinical trials board. This is another good way of finding out what's going on in your community, is to utilize the universities, especially the hospital-based and clinical-based universities. I hope that helped you, caller, but great question, and this is one of the first steps we are trying to embellish with other people is take the time, give a call, send an email, find out new things. Thank you so much. At this time, I know that we're going to be moving kind of fast because I definitely wanted to deal with health equity, but at this time, we're going to get into our whole concept of the opiate epidemic that has been affecting us since the early 2000s. I know that some people are wondering what the government, as they call it, and in my case, it's not the government. I'm very specific. It's the National Institute of Health, which governs all the health care that we get in the United States. Underneath NIH is HHS, which stands for the Health and Human Services. Each one of these components, or agencies, if you will, have a response to the opiate epidemic. And if you don't mind, I'm going to read a couple of those responses to you. It's on my phone. We're, high tech now. But one of the things they want to definitely do with the opiate epidemic is 5 key points. They're going to improve access to treatment, promote the use of reducing or reversing overdose drugs, strengthening our understanding of the epidemic through public health surveillance, which is what I used to specialize in. It was health surveillance. We're going to promote support or for cutting edge research on pain and addiction and advance the better practices and path for pain management. You know what? That sounded like a whole bunch of words. Let's turn this over to an expert who has worked in the field of substance abuse, who can probably give you some more specific nuggets about what we're doing in the opiate epidemic. It is truly a crisis, but how do we solve this crisis and how do we deal with it with all the other things that's going on in the world? This doesn't seem like it's the only one, but it is something that we do need to deal with. At this time, I want to show you that particular slide that talks to you about what the opiate epidemic is. And at this time, we're going to have our resident expert come in to talk to you about what has happened since this epidemic has come on board since the last 10 or so years. Charles Patton, want to welcome you to our new, our opiate epidemic expert.
Hello, hello, hello. All right, let's get this set up here so we can start to have some real conversations around how to address some of this scourge that's going on in our community. Well, good evening, my Chicagoans, my colleagues, and my friends. I want to just thank you for this opportunity to share some information with you. And as we had discussed in our last episode, that we are still in the midst of an opiate epidemic. And for those of you that don't know me, my name is Charles Patton. I am the People's Counselor representing Tacts, and I know you all just heard from our eloquent sister Ya. Now, let's talk about this particular epidemic. We know that there's a lot of health issues going on in this particular city, okay? And we know that there are some things that is affecting people of color a lot more, what can I say, as we say, disproportionately than other groups. But as it stands right now, this particular epidemic is affecting every population, and there are some things that we need to consider doing when it comes to learning about the opiate epidemic, getting involved with some of the policies that's been driving the epidemic. If anybody's been paying attention to the news lately, we know that there are several big pharmaceutical companies, that is being sued because of some of the practices that has allowed for this particular epidemic to take hold. Now, from my experience, being a counselor in the substance abuse field for over 20 years, I have observed in the last 10 years a shift in some of the clientele that we receive at our particular location in Inglewood. And what's been happening with this particular group of people is that they start off getting something like an oxycodone or a Vicodin, if you will, for an injury or an alleged injury. And once they can't get the prescriptions anymore, then we see them going into the communities and start buying some of this heroin. And what's been happening with that is that we know that people cut the drugs with different things. And unfortunately, one of those particular things is called fentanyl. And with that particular combination, we have been seeing a lot of deaths with this particular scourge that's going on at this time. So let me show you a slide. Hold on one second. Okay. I don't want to do that. All right, here we go. Now, if you look at this slide, I'm hoping you all can see it. In 2015, we had 426 deaths. As of 2016, we had 741 deaths. That's almost double the amount of opiate deaths, according to the statistics of the Healthy Chicago Epidemiology Report. Now, when you look at the age ranges, we're talking from 15 to 74, with the largest concentration being between that 35-year-old group and that 54-year-old group. So we have to really start taking some precautions and talking to our community, our family, our friends about how we can get involved to make this particular or start to address this epidemic. because we need to make sure that people get factual information. We need to make sure that people get the access to treatment and services that they are entitled to. That brings me to my next point. We know that there is some legislation that has been pushed as of last year. And according to one of the reports, we know that there was a bill called the Marino bill that was actually signed into law March 2016 that basically made it hard for law enforcement to prosecute pharmaceutical companies or drug distributors because of some of the legislation that's been put in place. So once again, I can't stress enough that as we as a community have to get involved and start talking to our local politicians, our representative electeds that's in Washington, D.C., and if you got any concerns, we need to get in their ear and let them know that they're here to represent us, and if they passing laws that's not going to benefit the people, then we need to get somebody else in that seat. That's what we can do. Now, if you look at the next slide, this is what we call the Marino bill. And basically, it weakened the DA's ability to prosecute drug companies. And this was signed into law by Obama. So we need to make sure that we go back and review it. It is H.R. House Bill 4709. So look it up. Start getting the information so that we can start to advocate for ourselves. Because we know they end up making profits. We got to fight to stay healthy. And once again, when you think about health equities, as y'all pointed out, it's not about getting what everybody else is getting. It's about getting what you need. And power concedes nothing without demand. So we have to demand that we get the help that we need. Okay. All right, there we go. All right, so I thank you all, and I hope that this will be helpful for you. Now, some of the other things that we can do, like I said, deal with the government. If you are a public health professional, then we need to start talking about how to get programs and do what we call get them proven. We need some track-based, competency-based programming that will help us to address this epidemic, give people the care that they need, and then once again start to advocate and lobby for legislation that will regulate the insurance companies to let us get what we need without them being the watchdogs, if you will, or the governing body that determines if you only get 3 days or 5 days or 6 days, but you can get what you need. Okay, that has been my charge for the last 20-some years, that we need to make sure that we fight for what we want. Now, as a community, we need to talk to our young people. As I mentioned, the onset of use, age of use is around 15. We know that that can be a little earlier in some areas. But we need to start talking to our children, our nieces, our nephews, our grandbabies, and give them the correct information about some of these substances out here. And not only that, to talk about staying healthy. I don't know if you all been paying attention, but there's an onset of diabetes among adolescents. That's unheard of when I was a child. When you got 16, 17-year-olds having type 2 diabetes. Okay, so we need to talk to them about health-related issues, particularly substance abuse, and also about HIV and how it's transmitted, how to prevent it, and other health-related concerns. So we need to start developing some type of community engagement activities. If you are not involved, then I encourage you to get involved. If whatever block you live on, if you got a block club, then you get with your block club. If you got an alderman, you need to know who that person is, because I'm sure everybody has an aldermanic representative that sits down there with the mayor. So you need to get in your representative's ear and let them know that there are some things that they need to do for you, or they can be replaced, because they work for us. Okay, and we need to be clear about that. And of course, we need to work in partnership, hear me again, in partnership with our healthcare providers. All right, so when you go and see your physician, unfortunately, a lot of times we know that they write scripts. And if you are in tune to what's going on with your body, you know when something works for you and when it doesn't. If it don't work, then you need to let your doctor know and start looking for some other alternatives. Also, I would encourage everybody to make sure that when you go and see your physician, that you tell them everything and that you get copies of everything, because it makes a difference when you have to go back and look for details. And we know the devil is in the details. So we need to make sure that we get all the correct information, because it's been my experience that knowledge is power. Knowledge is the key to being free from all social ills. Now, once again, when you look at this slide, it's health equities equal black unity. Now, don't get me wrong, I'm not anti-anybody, but I am pro-black. Because I know, once again, that Africans in America has been suffering the most when it comes to health ailments, when it comes to poverty, when it comes to lack of education, when it comes to lack of access. We have to make sure that we are advocating and working together. And once again, as you can see, this is what we call our Umoja campaign. And of course, you know that Christmas is around the corner. So once that's done, then we get into our Kwanzaa season. So this is a great time for us to get out in the community, start having some serious conversations about how to stay healthy as an individual, how to stay healthy as a family, how to stay healthy as a community. So we can get out and start to work, at least learn the principles and then work the principles. And then you become responsible for the health of yourself, your family, your community, and hopefully a nation, as we start to try to change some of the paradigms and some of the issues that's been affecting people of color, particularly in this country. They are doing research that is looking at some of the causation of a lot of the violence and other conditions that we are dealing with in some communities. And I'm sure that you all have heard, and some of you all, with my deepest sympathy, have been victims of some of this nonsense and violence that's going on. Some of you all have been victims of overdose deaths. Some of you all are still dealing with people who's addicted to chemicals, whether it be opiates, heroin, cocaine, alcohol. We still are dealing with these issues. So the best way is to come out, get involved in some of the programs that's going to be going on during the Kwanzaa season, and start to have some real serious discussions about what you want to do, how you can get involved. We had a caller earlier during Sister Yard's segment that was asking about getting involved in clinical trials. If you don't know about them, then try to find out about them, because that is how we can become advocates for our own health. And believe you me, it's been my experience that if you don't take care of you, then nobody else will. We have a society that's truly driven by finance. All right, let's be clear. And when I say finance, I mean other people get paid off our misery. I'm grateful for the work that I do. But that salary is paid because somebody is addicted to a substance. If you go into the hospital and we hear about all of the shootings and the deaths, but nobody talks about the cost to treat a victim that's been injured. So we have to be real serious about how we are going to approach this particular epidemic, address these particular issues, because truly it is our lives and our children's lives that's at stake. And I just want to throw in one caveat that we also need to start talking about what's going on with the prison industry, because that is another situation that helps perpetuate some of these conditions that we see. So when I'm talking health, I'm talking holistic health. I'm talking just not physical health, but financial health, mental health, and community health. We need to get involved and try to help create a shift that will help to protect our family, our seeds, our legacy. So with that being said, I want to thank you for your time.